Today I want to share some information about COVID-19, or what's also known as coronavirus. This is the virus that is keeping us all from doing our normal everyday activities. We've had it with us now for a few months, and it will probably stay with us for quite some time. So it is important to understand what it is and how you can prevent getting it yourself, and also what to do if you or someone in your family does get sick. The first thing I want to share with you is what is COVID-19 or coronavirus. It is a virus that causes infections in your lungs, your respiratory system. It can cause serious breathing problems and some other issues that we will talk about in a minute. But first I want you to understand how it is transmitted from person to person or from place to person. Okay. Here we have two people. This person is infected, has COVID-19. When they breathe, cough, or sneeze, tiny droplets, little tiny drops, that's what droplets are, very tiny drops, come from their nose and mouth. And then anyone near them can pick up these droplets when they breathe in. So if someone has COVID-19 and they cough or sneeze, or even just our normal breathing, can cause these droplets to be spread. Droplets are in our breath all the time. They just normally don't give us any problem like this. So these droplets can enter the nose or mouth. They can land on the nose and mouth and then enter, or you can breathe them right in. Okay. If we are closer than 6 feet, we are more likely to pick up these droplets when we breathe. So that's why staying 6 feet apart is very important. Unless the person sneezes or coughs, then the droplets can travel even farther. So be aware of that. Okay. This virus, COVID-19, can be spread by people who do not have any symptoms. They are called asymptomatic carriers, meaning you cannot tell that I am sick. I do not feel sick, but I can still have the virus and give it to other people. We also have what we call contact spread. So this is person to person. Contact spread means that if a person who has the virus coughs or sneezes, that lands on any surface. It could be on a table. It could be on the doorknob. It could be on your sink, your counter in the kitchen, any surface, light switches. And I will talk about that some more in a moment. But that is contact spread, meaning someone has coughed, sneezed, or even just breathed on a surface. Someone else comes along, touches that surface, and they can pick it up, which is one of the reasons why cleaning with disinfectant is very important. We know that these droplets with the virus, when they land on anything, that virus can last for hours or days on that surface, which is why it is important to clean. Okay. The virus is very easily spread from person to person or from surface to person. So these rules are very important for all of our safety, for yours, your families, your friends. Stay home whenever possible. Do not have other family members come inside your home. If they already live in your house, of course, they're there. But other family members, aunts, uncles, cousins, grandparents, should not be visiting your home at this time. Do not let friends inside your home. They also could be carrying the virus. Stay 6 feet away from people when you're out in public. Wear a mask when you go outside. Wear disposable, throwaway gloves. Wash your clothes as soon as you come home from shopping, because droplets can land on your clothing from other people. And children are less likely to get the virus, but if they do, some of them have shown to be very, very ill. Even more so than sometimes adults. And children will often have the other symptoms, which I'll talk about in a moment, but also a very red rash on their body. So it is important to protect yourself and others from this virus. You need to understand how it is spread. You need to wash your hands with soap and water thoroughly for at least 20 seconds. Especially if you have been in public, have coughed into your hand, or blown your nose or sneezed. Make sure you wash your hands. Throw away any used tissue. If you blow your nose into a tissue, throw it away right away. If you do not have soap or water, use hand sanitizer that is at least 60% alcohol. How do you know that? It will tell you on the sanitizer. If I look at this bottle, it says at the top, ethyl alcohol 62%. That means that this is a good hand sanitizer to use. Okay. Avoid touching your eyes, nose, and mouth, especially with unwashed hands. Another reason to wash your hands often throughout the day is because we often will scratch near our eye, rub our nose, put our finger near our mouth without thinking about it. So if you wash your hands often, you are less likely to pick up the virus and then get it near your eyes, nose, or mouth. Avoid close contact with others. That means going outside unless you have to, but also close contact with people who are sick, especially people inside your home. Keep at least 6 feet away from people when you are out in public. Do not get together with other people. Stay away from crowds. And keep away from others, keeping away from others is especially important for people who have health issues. Someone who has cancer, diabetes, heart problems, breathing problems like asthma. Those people need to be even more careful because their body is already fighting illness. They need to make sure they don't make it worse. So the symptoms of COVID-19 are several, and you do not have to have all of these symptoms or even any symptoms to be able to spread this virus. But symptoms of COVID are cough, difficulty breathing, a fever, usually over 100 degrees that last, it will not go down. Chills Chills means you just feel cold, but there's no reason for it. Muscle pain. You're feeling achy all over. Sore throat. Loss of smell or taste. Smell or taste. So, if all of a sudden you cannot smell things you normally could, or when you eat, you cannot taste food the same way, that is also a symptom. But also, this happens less often. Nausea, meaning your stomach just feels really upset. Vomiting, or diarrhea. And again, with children, an added symptom is the red rash that they get. So you do not have to have all of these. And if you have a cough or if you have a fever, that doesn't necessarily mean you have this virus. It just means that it's a possibility. So you have to pay attention and you have to seek medical help when necessary. So when should you seek medical help and what kind? If you continue to have trouble breathing and it's getting worse, if you have pain or a pressure, a pushing feeling on your chest, if you suddenly are getting very confused, you cannot think clearly, and this is something new to you, if you cannot wake up or stay awake, if the person's lips or face start to turn a little blue in color, that means they're not getting oxygen from having trouble breathing. And what should you do when someone has symptoms and they're getting worse? Do not immediately go to the hospital. What you should do first is call your doctor. Talk with your doctor about your symptoms. If they are very bad, call 911 or the emergency room before you go. Why? Well, if you do not have COVID-19, maybe you have a sore throat, a little cough, a little fever, that doesn't mean you have COVID-19. But if you go to an emergency room because you think you do, you could actually pick up the virus. So do not go immediately to the emergency room unless your doctor tells you to, the emergency room that you have called tells you to, or 911 comes after you've called for help and they take you to the hospital. Excuse me. It is important to cover coughs and sneezes. When you cough, make sure you cough into the inside of your elbow, like this. Okay? If you are sneezing, use a tissue and throw the tissue away immediately. After you cough or sneeze, wash your hands, and again, with soap and water for 20 seconds, or use hand sanitizer. What I'm going to do right now is demonstrate what we mean by 20 seconds and how to wash your hands. We often think, oh, okay, I've washed my hands. That is not 20 seconds, it is not thoroughly. So let me set the timer and I'll start washing my hands and you can see how I do it. One moment. Okay, my 20 seconds is running. I wet my hands, I put soap on them, I rub them very thoroughly between the fingers, the backs of your hands. Make sure you get every finger and thumb. Make sure you wash your wrist also. And then make sure you clean your fingers? Okay, need to shut off the timer. Your fingers you should clean like this because we don't pay enough attention to our fingernails. So wash the palms of your hands, each finger and thumb, the backs of your hands, your wrist, and your fingernails like this. Rub them hard. Okay. Again, if you do not have soap and water, use hand sanitizer. Cleaning and disinfecting in your home is also important. You should clean and disinfect surfaces every day. This means tables, doorknobs, light switches, counters, like in your kitchen or bathroom, handles, like on a drawer, your desk, phone, keyboards, toilets, faucets, and sinks. There again, you might think everyone in your home is okay, and they may be, but they may have picked up the virus and not have symptoms, so it's important to clean daily. Use soap and water first to clean all of these surfaces. Then you use a disinfectant. It could be bleach, ammonia, or disinfecting wipes if you can find them. Never mix bleach and ammonia. That is a very dangerous combination. It creates a gas that can make you very sick. So bleach or ammonia, not together. Wear gloves when cleaning, and I will be showing you how to put the gloves on and take them off. Do not use expired cleaning products. Cleaning products should have a date on them that tells you how long it's good for. Look for that date. If the bleach, ammonia, wipes are expired, meaning the past due date for them to be effective, don't use them. They will not work. Okay. You need to dilute bleach if you are cleaning with bleach. And I will show you how we do that. Dilute means add water to. So I'm going to pretend that this is my bleach. If I'm going to make 1 gallon of cleaning solution, I will use 1/3 cup of bleach for every gallon of water. Okay? Fill up the container first with water, then slowly pour in the bleach. 1 gallon, 1/3 cup. If I am not going to make as much, I can make 1 quart, which is equal to 4 cups. And in that, I will add 4 teaspoons of bleach. Teaspoon. So I add 4 of these to 1 cup of water. These cleaning solutions will be good up to 24 hours. So don't make more than you're going to use in 1 day. After 24 hours, they are not as effective because they've been diluted, added with water, and you need to throw them away. 70% disinfecting alcohol solution can also be used instead of bleach. But bleach is usually easier to get a hold of. It's the best thing to use. Okay, let me set these aside. Now, what if someone is sick? They have COVID-19. Not everyone with COVID-19 is going to need to go to the hospital. Most people will not. Only those who are seriously ill and have been told by a doctor to go to the hospital should go, unless paramedics also say you need to go. Okay, if you are sick or someone in your family is sick, you should stay as far away from everyone else in your house as you can. Stay in their own bedroom. If possible, use a bathroom that's only for them. If a person is sick but can still take care of themselves, they should clean the surfaces in their room every day, especially if they know that they have been coughing or sneezing or touching a lot of the surfaces. They should clean them. If sharing a bathroom, the person who is sick should try and clean those surfaces also. Sometimes when we're sick, we're very sick and we can't do that. We need people to help us. If you are cleaning a room or bathroom that someone is using who has COVID-19, make sure you wear disposable gloves so you can throw them away. A sick person should eat in their own room. You should keep dishes and glasses set aside just for them, that no one else is using. Because no matter how well you try and wash, it doesn't mean you get all the virus off. So a sick person should have their own dishes and glasses. Wash the dishes and glasses in the hottest water possible. Wear gloves when you're washing those dishes. Wash your hands after you take off your gloves. And give the sick person their own trash can with a plastic liner in it, disposable liner, so that trash can be thrown away whenever necessary. Also making sure you wear gloves when you throw away the trash. Now I'm going to talk about cloth face coverings or masks. This is one example that was made by a friend of ours who likes to sew of a cloth face mask. You should wear one whenever you go out in public, even if you do not feel sick. Again, you might have the virus and not be showing any symptoms. Okay, this protects others in case you are sick. Even if you wear a face mask or covering, you should still stay 6 feet away from other people. You fit the cloth mask snugly to your face, which means not too tight, but you don't want it too loose. That is important. You need to be able to breathe, but you want to keep virus from being able to get in through the sides. You use ties or ear loops like these to hold the mask in place. It is best if the mask has more than one layer of material. So if you have one layer, that's protection, but 2 or 3 layers is more protection. The mask should be able to be washed and put in the dryer without damaging it. So you have to be careful to make sure that you get the dryer hot, but not so hot that your mask is damaged. If it is, throw it away. Do not put masks on children under 2 years of age. People who are having trouble breathing, they need to be able to get all the air they can. Or someone who is unconscious, you cannot wake them. Do not use surgical masks because those are needed for medical personnel. Do not touch your eyes, nose, or mouth when removing a mask. You can make masks at home, and I will be sending along instructions how to do that. First, I'm going to show you how to put on a mask and then to put on the gloves. Wash your hands first. Put the mask on with either tying it in the back or using the ear loops. Then you need to make sure the mask is snug over your nose, so you kind of pinch it, and pull it down to cover your chin. The more of this area, top of your nose, under your chin, that is covered, the better and safer you will be. Okay. Now, I'm going to put on my gloves, and that's easy. You just put your gloves on like you would any other gloves. But remember, once you have them on and you go out, your gloves and your mask could be infected with the virus by touching objects, by being near people who are sick. So taking them off is very different. You need to be more careful. So I'm going to put the gloves on and then show you how to take them off. So when you put them on, pull them down as far as they will go. It's very important to protect your wrist also. You don't want to pick up virus along your wrist. Okay. So pull it down as far as it will go. Now, excuse me, you will pinch the palm area of the first glove, pinch right here, turn it inside out, like this. So the contaminated part is on the inside. Then you hold it in your hand like this. You reach under the glove. Don't touch the surface on the outside. Reach under the glove and pull it off like this. Now the contaminated area is on the inside, and you throw these gloves away. Okay? So then I would take my mask off after I have my gloves off. So you simply either untie it or pull it off with the loops, but do not touch the outside of the mask right away, not until it has been washed. So pull it off. And do not touch the mask. This needs to go into the laundry right away to make sure that it's properly cleaned and dried. Okay. So those are some of the most important issues that you need to understand about COVID-19. Do not go out of your home unless you have to. If you do, stay 6 feet away from other people. Wear a mask and gloves when you go out. This is for your protection, the others in public, but also for your family back at home. Remember to clean thoroughly your home, but also to wash your hands often during the day. Not just when you come back home, not just when you sneeze, but often, because we touch our eyes, nose, and mouth without even thinking about it. And we want to make sure we don't have any of the virus on our hands. Okay, so thank you for watching this. Please ask your teacher about any questions you may have. And I hope this has been helpful for you and your family. Thank you.